one of the assistant directors. All right, I'm gonna run it back. So hi everyone, my name is Zev Saquon Manka. I'm one of the assistant directors at Source. I wanted to say hello and welcome to our Source partner panel. This panel is a focus on food insecurity in Baltimore. So today, before we begin, I just want to introduce some of my team. We have the founder and director of Source, Mindy Levin, on the call. I believe we have our associate director, Tyler Dareth, as well. We have Rosemary Rio as our assistant director for Academy Service Learning, as well as our communication specialist, Izat. And we also have our new administrative assistant on the call, Aaron Rich. So I just wanted to give a special shout out to our team. A little bit about Source. We are a program where we're engaged in the community, and we do service learning as well for Johns Hopkins School of Public Health, Nursing and Medicine. Our mission is to engage the Hopkins University health professional schools and Baltimore communities in mutually beneficial partnership to promote health and social justice. Our values are reciprocity, justice, service, and collaboration. So once again, I just wanted to say that this is our kickoff event for our annual Baltimore Week celebration. So welcome. We're doing so by hosting this important event to discuss food insecurities and advocating for accessible nutrition and the roles that these organizations that we have on the call today play within this. So I really wanted to get going. We only have an hour, so I really want to hear from our panelists and allow some of our participants to ask some of the questions that they may want to ask. If you have questions, feel free to put them in the chat. They are being monitored. We're going to have our community-based organizations talk to us a little bit, let us know what they're doing towards food insecurity and ways that you all can get involved as well. After they talk, there'll be some time for them to answer some questions and for some open discussion. So if you want to just throw your questions in the chat, we'll be happy to get to them as soon as we can. So I really want to start this off. So I want to hear from our wonderful guests and our community partners who are on the forefront of alleviating food disparities. We're going to get right going. We have Good Harvest, Henderson-Hopkins, Maryland Food Bank, and Moveable Feast on the line with us today. What I'm going to do is I'm going to introduce one organization at a time and let them speak to you all. Then I'm going to introduce the next organization after they're done. So we're going to start with Good Harvest. Majid, I'm going to put you right on the spot there. So we have Majid Zakari, the Vice President of Good Harvest, on the line. It's great to hear from you. And if you could just let us know a little bit about Good Harvest and what you all do, we'd be happy to hear from you.
Hey, thank you so much. How are you, everybody? I'm fortunate to be on this call just to share some of our initiatives and our mission with everybody. Good Harvest is the social enterprise of St. Vincent de Paul. So we started, I think, in 2012. And really, we have dual purpose. One of it is food access in desert areas or insecure areas in greater Baltimore area. But also we have a workforce training here, culinary training for youth between 18 and 24. So one of the main things to really make an impact in the city and the surrounding areas is really our partnership with a lot of players or stakeholders, and most of them are nonprofits. Like as for right now, we are serving over 3,000 to 3,500 patrons a day. 80% of them are kids in Baltimore City, but the rest of them also are adults. What we noticed from 2014 to 2022, that this insecurity or hunger exists also within senior population. So last 2 years, we start serving a lot of senior centers. So that's another reason we change our name and everything, because the demographic also changed. So our hope or our goals really every day is to increase access to as many places as we can. So really, that's what we're trying every day, every month. So with our partners and with other, politicians or, delegates, that's what we are doing on a daily basis. So, but as everybody know, with inflation and supply and demand, we have to change many things to, to cope with all those expense. So we're still serving almost with the same amount of people we got later help, but we are hoping things really will change moving forward. So as far as we have also a volunteer program. Most of our volunteer program is in the mornings. We have two slots, 9 to 12 and 12 to 3. Right now we get good amount of Johns Hopkins students, but also we get other people from other organizations from the city. So we put it in Engage, and we have a volunteer coordinator who is, watching all of that stuff. So if I miss anything, then I'm here for any question.
So what I believe Majid was speaking about in terms of Hopkins Engage for all of our Hopkins students and staff, Good Harvest puts opportunities on our resources so that you can just directly register for volunteering and other types of help there. If one of my colleagues could be, okay, there we go right there. So if you want to look in the chat, we have the Hopkins Engage link right there. So if you ever want to go on Hopkins Engage, go onto our source site and look at some of the events and partners that we work with. That's an opportunity to work with any of them. So thank you so much, Majid, for letting us know what you all do. Majid's gonna stay on the call so that if we have any questions that want to get directed towards him, there'll be an opportunity for him to answer. But we're gonna, for the sake of time, we're gonna move right along. We're actually gonna go to Devani in a Maryland Food Bank. So I'm gonna relieve my microphone and let her go ahead.
Good morning, well, good afternoon, everyone. My name is Devani Franklin, and I serve as the Regional Program Director for the Baltimore City region of the Maryland Food Bank. The Maryland Food Bank is a nonprofit hunger relief organization dedicated to feeding people, strengthening communities, and ending hunger for more Marylanders. MFB meets the immediate needs of vulnerable communities while collaborating with community partners to provide resources beyond food and address root causes of hunger so that more Marylanders can become financially stable and thrive. As far as the work we do, we work directly with community organizations in our neighborhoods and all over the state, and communities all over the state, to make sure that we're meeting the needs of Marylanders who need us most. Our first major line of defense are those community network partners, as there are boots on the ground and our eyes and ears so that we understand the needs of our neighbors as we shift to meet them. Over the last 2 years, our primary focus has been on keeping as many network partners open and operational as possible through the COVID pandemic. The food bank typically supplies more than 330 network partners operating nearly 1,300 distribution channels. That's food pantries, emergency shelters, feeding centers, schools, community centers, and senior residences that rely on us to keep the flow of food going into communities that need it the most. Last year alone, we distributed enough food to support nearly 170,000 meals every single day. That's almost 62 million meals in 1 year. So how you can get involved with us, because all of this work takes a lot of support and help. We don't do it alone at all. As I said, we do rely on the work of our partnering agencies who are mostly run by volunteers, but also our operations alone rely heavily on volunteerism. We welcome individuals, groups and families for a variety of tasks, including sorting and packing food in our Healthorp location, helping prepare meals in our on-site kitchen, and even gleaning fresh fruits and vegetables on Maryland farms. You could visit our website at mdfoodbank.org/volunteer to learn more about those excuse me, a partner was calling me, to learn more about those opportunities. And I will put that in the chat so that you can check that out on your own. You can register as a volunteer and learn about all of our upcoming opportunities. And I'll stop there and leave the rest for questions, because that's the Maryland Food Bank overall, but we've been doing so many juicy things in Baltimore City alone too. So I'll leave that for questions.
Got it. Thank you so much for sharing, and I also love your background right there. So we're gonna keep it pushing and go right along to Angie over at Moveable Feast.
Unmute. Hi, thank you so much, Source, as always, for having Moveable Feast. So yeah, I'm Angie Kelly. I'm the Community Engagement Manager over at Moveable Feast. And what we do is we home deliver medically tailored meals to clients who are living at the intersection of chronic illness and food insecurity. So it's a very specific group of folks who are experiencing barriers to healthy food access for a variety of reasons. You know, it may be lack of transportation, maybe they don't have like a strong community support system or family around, you know, maybe because of their treatment for whatever their illness may be, they don't have the physical strength to be able to cook a meal for themselves, live in a food desert. And then of course, there's always affordability of food. And then our clients are in treatment for a wide range of illnesses, anything from HIV to a variety of cancers, heart disease, renal disease, lung disease. And, you know, we're always looking at ways to expand out to other illnesses. So what medically tailored means is that it's really catered to the dietary needs of that individual. Part of our motto is that food is medicine. So in order to be on the program, it is medically referred. However, once the person is on our program, it's not an insurance-based program. So like once you get onto the program, it just comes completely at no cost. And then our dietitians work with the clients one-on-one, mostly via telehealth these days, of course. But really try to do a lot of education, and it's called medical nutrition therapy, to help our clients really understand, you know, what this change in diet is going to do for them, and help them to become more self-sustaining, you know, more empowered to, you know, take care of their nutrition, like understand how to take care of their nutritional needs to give them the best possible health outcome, you know, in conjunction with their treatment for their illness. And so everybody gets medically tailored meals every single week. We offer fresh produce and actually interventions and prevention with our clients. And so we have doubled the produce that we provide to our clients every single week. There's the medical nutrition therapy, supplements, if that is a need that a client has. We also have a family program, so that if there is a client who is in treatment and they have dependents, they get put on our family plan, so that the entire family is supported through this. And then also medical transportation, so transporting our clients to their doctor's appointments. And you know, the food, the way that it really supports the clients is that it's not just the nutritional value of having the healthy food, right? It's also about the fact that it puts clients in a better place to be able to care for themselves with the requirements of their treatment. So for example, clients may miss their medication if they don't have food to take their medication with. Thus decreasing the chances of them having a good outcome with their treatment. And, you know, I think that's something that when we think about food insecurity, we may not be thinking about like those impacts, like the other ways that it negatively impacts a person's health. So that's what Moveable Feast does. We've been around for 33 years. We actually started in response to the HIV crisis of the 80s, but over time we have transformed to what we do today, and we serve almost the entire state of Maryland, and all meals are packaged and produced from our East Baltimore location. At any given time, we have approximately 850 clients on service, but as people cycle on and off of the program throughout the year, that ends up being, anywhere from 2,500 to 5,000 clients annually. And of course, that has increased since the pandemic. During the pandemic, we increased our services from 600 clients at a time to 850 clients at a time, which has increased our need for volunteers who do help prepare and package all of these meals that go out to our clients. And like many organizations and industries, we are also seeing a big shortage in staffing in our kitchen. And so we are really relying on volunteers more than ever to help us produce those almost 9,000 meals that are going out to clients every single week. We literally have 4 people in our kitchen staff right now. So we have shifts Monday through Friday morning from 8 a.m. to 11:30 a.m. And we just introduced afternoon shifts from 12:30 to 2:30. And we're always looking for individuals and groups to come support us by preparing and packaging these meals. And it's very flexible. You don't have to sign up for like a dedicated shift every single week, like really just when you have the availability, sign up and come on in. And then another way that you can have a direct impact is by becoming a delivery driver. Yeah. So did I miss anything? I got it all? All right, cool. Thank you.
Yep, you're good to go. And I believe we actually have I'm sorry. I believe we have Henderson-Hopkins on the Zoom call as well. I believe we have Annie Weber, the community school coordinator. Annie, how are you doing today if you're on the call?
Hi, can you hear me?
Yes, we can.
Great. So sorry, I was having some trouble signing into the Zoom link. I'm on my phone. But my name is Annie Weber. I'm the community school coordinator at Henderson-Hopkins Partnership School. So we are a pre-K through 8th grade school, and our operator is the Johns Hopkins School of Education. So we're a Baltimore City public school, but, our operations side comes from Hopkins. So we serve about over 600 students from the East Baltimore area. So since my work as a community school coordinator is to provide wraparound services for families in the community. So we, since March of 2020, we've started a pretty large scale food distribution program in partnership with the Maryland Food Bank. I heard Devani was on the call, with World Central Kitchen and different community partners, where we, every Friday since March of 2020, we have distributed around 7,000 pounds of food to anyone in the Baltimore area. There's no barriers, so people drive up and people walk up. We have a variety of food from produce, non-perishables, sometimes frozen meals. It's open to anyone. For us, food insecurity has been a challenge in our community before COVID-19. Previously, we were serving at Henderson-Hopkins before schools shut down. We were serving over 1,000 meals a day to students. We're doing that, now since kids have come back as well, but we knew that there was an even greater need in our community when we're still seeing cars. If you've ever been to our school, our distribution is on Ashland Avenue. We see cars wrapped around the corner most weeks, especially with inflation, with prices going up with groceries. So we've really become a staple in our community as a food distribution site, and a reliable source of different types of food for our families and for our community. So we rely on volunteers to pack food from 9:30 to 11:30 every Friday. And then also there's a second shift to hand out food from 11:30 to 1:30 to neighbors that come up. So yeah, I don't think I'm missing anything. But if anyone has any questions, Source can provide my email address. I know Saquon mentioned that we use Hopkins Engage for volunteer signups. So we have all of the Fridays listed on Hopkins Engage, and you can sign up there. Thank you.
Thank you so much. So we've heard from all of our panelists kind of a quick rundown of what they do and how you all can get involved. I'd like to say these are champions of the food security world, where they've really dedicated their time to alleviating this problem. And any way that you all could assist or volunteer or collaborate, or even just make yourselves more aware of what's going on, that'd be lovely. I know that in May of 2022, Brandon Scott announced that like the total amount of money being allocated toward, or Baltimore City's total amount of money being allocated towards like nutritional security was around 26 million. So there's a huge need. There's a lot of things going on since COVID, and that actually brings us to one of our first questions that we wanted to ask the panelists. So what I'll do is I'll kind of ask this question, and I guess I'll call on each and every one of you all to kind of answer the question. If you want to pass, just go right ahead. But the first question that we had towards you all was like, how have you really pivoted your services to meet the community's needs during the pandemic? And I know like some of you all kind of spoke on it, but if you could kind of just revisit it a little bit, and I guess we'll start off with Good Harvest. Majid, if you want to.
Yeah.
Kind
of, well, one of the first thing, because of COVID, we changed our line of business, because instead of congregate meals, we move almost 100% to individual packaging because of that, 6 feet distance. And also a lot of sites were doing curbside, outside in their parking and stuff like that. So one of the advantage during that period is USDA passed couple waivers. Like there are certain things we were required to do, but they waive it because of the pandemic. So actually it made the food service for us easy, and we reached more people because of it. So if I recall properly, we were doing maybe, I don't know, like 7,000 to 8,000 meals a day during that period. Then once the waiver expired, I think most of them expired last June. So we still are serving individual packaging now because of the city. They still have some regulation. So our shelters are still individual packaging. So really what happened is just the nature of the meal, the production or the nature of our meals changes from congregate meal and family style to individual. But also with that come also some limitation and restriction. There are certain products you may not find to move that way, or also facility wise, or transportation, or anything, but what you try really when you have those issues, you just try to mitigate, because at the end of the day, you just try to hit as much, serve as much as you can, do as much as you can increase the number, but with limitation, the numbers went down, but we're still doing the same thing right now. We have both of them, but I know the city, they still have a lot of restriction comparing to Baltimore County. Like there are things we can do in Baltimore County we cannot do in the city right now.
So it's been really navigating
Yeah.
those challenges and trying to get as many opportunities as you can from them while you're going through.
Yeah,
Got it. Just to make sure you're getting the food out to the people.
Yeah, so really that's what you do. Once you come in the morning, you just look what's going on and you try to, our facility is huge, it's 10,000 square feet. So we have the capability to deliver any kind. It's just you are delivering the county different from the city. But in a lot of times, really, it comes for us. It comes to it's financial. Like we try to get as much help as we can or donations, because the social enterprise is non-profit social enterprise. So our intention is not to make money, honestly, but just to provide as much as we can.
Right, to meet that physiological need. Gotcha. All right. Well, thank you for that answer. Let's move on to Annie Weber over at Henderson-Hopkins. Annie, how has Henderson-Hopkins pivoted or kind of shifted to meet the needs of the community during the pandemic?
Can you hear me?
Absolutely.
Okay, so yeah, we before COVID, we worked with the Maryland Food Bank to do a once a month heart market, which was some fresh fruits and vegetables, some non-perishable foods, but it was just open to our families. So families could come in, they could shop for what they wanted to take home, and it was once a month, just for our school families. We pivoted during COVID. It was that we got the call that we weren't going to be in school, that maybe second week of March in 2020. And it was maybe a week and a half after we were like, okay, we need to pivot to make sure our families get the food that they need. And we also opened it up to the community. And those first few weeks we were astounded about how many people came up. As we went from before COVID, it was about 3,000 pounds of food a month. Now, since March of 2020, it's 7,000 pounds a week, or up to over 1 million pounds of food that we've served with our food distribution site to 50,000 people. So, it started off small with this partnership with the food bank, and they have been really wonderful working with us to make sure that we're meeting the need of our families and our community. During COVID, we also delivered to families. So families signed up for food delivery. We don't do this anymore, but they signed up for food delivery, and we recruited volunteers from Hopkins and just local, whoever we could get, but most of our volunteers come from Hopkins to deliver food to our families. Yeah, that's kind of how it's shifted. We're kind of going back to our new normal, where our school families are, still in need somewhat, but it has, we feed our kids in Baltimore City Public Schools. Meals at schools are free. So we're back to that 1,000 meals a day with our food staff. So that need is being met during the school day somewhat, but there's still need here and there. So that's how COVID has changed. We're still pushing every Friday, because our community, we really still see the need in our community.
Thank you so much for that. We're going to keep going over to Maryland Food Bank. So I would like to know like how you all have been operating during COVID and how that's been.
Yeah, sure. Thanks for the question. So there's three main things that we did during the pandemic to address the outstanding need that was exacerbated. So we brought as much food as possible. That's the first thing. We also alleviated the strain on our network partners for having to use funds to receive food from us. There are just some fees that certain partners have to pay in order to receive foods that are donated from us. So we alleviated that strain altogether. In total, I think we gave our network partners about $10.8 million. That's pretty much how much we compensated them instead of having them paying for food. We also basically develop new methods to safely distribute food. So we developed bubs, which are backup boxes, pre-packed boxes of food, and we had variations of them to support the Spanish-speaking community, older adults, and diabetes friendly. Those are the three populations that we had variations for. And then we had a general overall healthy backup box that we distributed to the community to support grab and go meals. Initially, before the pandemic, we encouraged more choice involved in selecting food so that folks can experience dignity and we can reduce food waste by allowing folks to select the foods that they will be eating. However, with the issue of social distancing and, a worldwide pandemic, we had to switch to, more effective means so that people could still be fed. So we basically looked at the information that we had and took our best shot in the dark to try to get some variation in the meals that we were providing to people who needed them the most. So we did that. We saw our pantries evolve with not just grab and go meals for school programs and our pantries, but also drive-through models and home delivery efforts, just like Annie so graciously alluded to with Henderson-Hopkins. They were one of our star players as we try to expand food distribution and access. They definitely rose to that occasion. So shout out to y'all. In conclusion, we really saw a huge increase in the amount of food that was distributed because of those means. So from March 2020 to the end of June 2022, the food bank had distributed enough food to provide more than 100 million meals to Maryland, and that's a 73% increase compared to the same time period pre-COVID. So we definitely responded to COVID by doing more on all fronts and reducing barriers for our partners to even receive the food to give out to our community members. Now we have to end our food to the network grant. That's what it's called when our partners order food but don't provide any funding to receive it. That is ending at the end of this year, December 2022. So I'm spreading this word far and wide because I'm really concerned about what happens to neighbors when we can't provide all of that food that we have been. So yeah, we're working on that issue right now, but just sharing. Thank you.
Wow. Well, thank you for sharing. Thank you for sharing. We're gonna keep it going to Movable Feast for Angie. So like, hey, if we could just hear about like some updates or survival tips for navigating in COVID and distributing food and helping.
Yeah. So our thing, at least at the beginning of the pandemic, was really maintenance. We needed to position ourselves in a place where we would not have to stop services to anybody because we did completely suspend our volunteer program. And as I mentioned, we heavily rely on volunteers to help get those meals out. So the way that we pivoted is that our clients, they get 12 meals a week, and it's typically 12 different meals a week. But we had to streamline our process to make it easier for the kitchen and the office staff who ended up working in the kitchen to be able to still produce 12 meals and get 12 meals and get them out to every single client. And so that's really where we were for a long time, was just getting out what we needed without having to suspend services. We were hearing from a lot of our clients, because for many of our clients, we are their main source of sustenance, and not just sustenance, but also main source of support. Like for many of our clients, our drivers might be the only person that they see every week outside of their, doctors. And so clients were calling us on a regular basis, feeling very afraid of what was to happen. And these are people who are severely immunocompromised. And so you can imagine the pandemic was especially terrifying for our clients who were at incredibly high risk. Typically, our goal is that we're making all of our meals from scratch so that we can have as much control over our ingredients as possible. But we did have to pivot to, several pre-made things to just bust those meals out and get them out to clients. And I'm so glad to say that we were able to keep that up. And we did not have to suspend service to anybody. And in fact, we went in the opposite direction and increased our capacity for clients. We are slowly getting back to our, what we call like our back to scratch campaign, or back to scratch program, trying to go back to making as much in-house as possible. Those ingredients are so crucial. And so we really were just kind of in survival and maintenance mode for a really long time. And now that we do have our volunteer program back and we just added our afternoon shifts, we can see the light and see us being able to move back towards the expansion of having a wide variety of meals available for our clients. And we are currently reviewing what our capacities are to expand our services in all directions and what it would take to get to there. We have kept our no contact deliveries. So the driver and the clients, they are still seeing each other, but, dropping the meals off and taking a step back and waiting for the clients to come out and receive them. We did have to switch to telehealth appointments between our dietitians and our clients, which you can imagine, was disruptive or like difficult for some of our clients, because that means that requires them to have the technology necessary to be able to do that. So whether it be like an actual video appointment or just a phone call, or even when our drivers are coming, even just, like doing a quick check-in with our clients, it really prompted us to take a look at the ways that we communicate with our clients so that we can better meet them where they are, instead of just making an assumption that they can just get to us in whatever way it is that we're asking them. Yeah.
All right, well, thank you. And thank you to all the panelists for hearing about like how you've been navigated during the pandemic. So for the sake of time, I'm going to shift kind of the format of how we're doing this panel. To ask a question, and any of our community-based organization panelists, feel free to chime in as you see fit. We don't necessarily have to go in order, and you don't all necessarily have to answer the question. But our next question is, how have been and how are volunteers contributing to like the mission in light of remote and hybrid activities? So I guess like what I'm really asking is like how can our Hopkins community get more involved? What are they doing? Are there hybrid opportunities? What can they do? What can we do to be more involved?
I'm already unmuted, so I'll just jump in. So one of the other things that we did during the pandemic that has also presented itself as an opportunity for off-site volunteering are client care packages. In addition to food insecurity, a lot of our clients also didn't have access to PPE and basic other personal care items that they needed. And so we started doing a call for like masks, sanitizer, bar soaps, lotion is a big request as well. And then like a few other personal items. And so something that individuals can do or groups can do offsite if they're not quite ready to come back in person is they can actually host like a client care package drive. And you know, if you have the capacity, assemble them and then drop them off at Moveable Feast, or just collect the items and drop them off at Moveable Feast, and we can have volunteers on site package them up for our clients. And it's something that our clients have been incredibly grateful to receive.
All right. Well, we also have a donation drive going on right now in lieu of Baltimore Week. So if anybody wants to donate, we've been throwing flyers out. We're going to have more information about our donation drives in the chat shortly as well. But is anybody else interested in answering the question of how people can get involved, if there's hybrid opportunities or if there's any other way to get involved, specifically with the pandemic still going on?
Hi, can you hear me?
Yep.
It's Annie. So at Henderson-Hopkins, we rely on volunteers to pack our food and distribute our food out to neighbors on Fridays. So, you know, if anyone is interested, we have ebbs and flows of volunteers based on people's class schedules. So we're always looking for volunteers if anyone's interested. And we're fairly, we're close to most of the graduate schools. So there's also the shuttles are a good way to get here as well. So if anyone's interested, it's always a good time. We're always playing music. It's a good chance to meet new people, and to also, if you're available on one Friday or multiple Fridays, to give back to the community.
If I may, Saquon, I just put in the chat a find food resource. So on the Maryland Food Bank website, if you go to mdfoodbank.org/find-food and put in a zip code or an address, you can find pantries that are around you in Maryland. That's good to know if you have a need, or if anybody you know has a need. We all can be community development workers in that respect if you have a resource. So please share the information. But also what we've seen throughout the pandemic is our church partners didn't really have their congregations come back. And we had a lot of our pantry coordinators who are in churches, which a good like 30% of our network are churches. Like some of them passed away or just not able to come back and serve their pantries. So what we're finding is those who are stepping up to support the pantries aren't really tech savvy and miss emails and don't really know how to navigate a lot of the platforms that we are using to grow our network to reach more people. So that's like one thing that we're going to be trying to work with agencies in the future to do, is to try to pair some of these pantries with aging coordinators, with younger volunteers who may be more tech savvy, or at least understand how to use, email and Microsoft Word, so that we can still work with these agencies who are used to supporting their communities, but just might not have the resources to do it in this day and age yet. So I put the link in the chat. So if you could just like check and see who's around you, it might be good to just like call them and see, do you need any help? Because all of our pantries are run with volunteer support.
Right. So we actually have a question that was put in the chat that I'm gonna ask. And to our audience, if you have any questions that you want to address to the panel, just feel free to put it in the chat and I will try to get your question in. But this question is, are local advocacy organizations that our panelists, I'm sorry. So I believe the question is, are local advocacy organizations that our panelists would promote highlight local policies issues related to food insecurity that Johns Hopkins University students and staff can support more directly? So I believe, so I'm trying to understand. Rosemary, are you still on the call? Rosemary?
Can you hear me now?
Yes. Do you mind just
No, not at all. It's supposed to say, are there local advocacy organizations that our panelists would promote? So are there, so we've heard a lot about the organizations and what you're doing on the ground, meetings of communities and individual clients, but I'm just sort of moving the lens out a little bit more. Do you have partners that are sort of working on the policy and the sort of advocacy level that students and staff could also support? So, who do you all sort of work with as we're moving working at some of the root causes? You all are on the front lines, but who would you recommend are your partners to address food insecurity? So, and thanks, Angie, for that as well. But if others have any other partners that you would help us learn more about.
Yeah, so I know for the Maryland Food Bank, we work with a lot of different agencies, and right now, like the issue that we're seeing is it's just a huge disconnect. So we have like Food Pack, with which like some members of, Johns Hopkins team like help us on that team too, and it's like other agencies who affect the food landscape in Baltimore. We just had like a Department of Planning had a feedback session just last week to collect ideas on how to address food security in Baltimore. But one of the things that is continuously raised in these spaces is that the people who are impacted by food insecurity the most are typically not at these tables. So I know the Maryland Food Bank, we have an advocacy and policy wing where we we have a person who's dedicated to looking at policies, listening to our community members and figuring out what should our legislative agenda be. And we're constantly building that. We know that January is coming up, which means this is a huge time for like providing feedback on what bills and political agendas you want to support. So with that disconnect that we have seen, I know the Maryland Food Bank is currently working on regional convening so that we can bring together not only our partners, but those agencies like Build and Rebuild who support a lot in the East Baltimore communities. So they did a lot during COVID to make sure there's home delivered foods, and they also do some advocacy work. We work with the Bloom Collective over near West Baltimore, but East Baltimore, Baltimore is a city of neighborhoods, but we work with like a few different community collectives to just try to keep our ear to the ground and support grassroots efforts. But the big issue is just like all of these efforts don't talk. So we're just trying to set a table next year so that we can have these different entities at least like funnel through and share information with our community members so that we can best work together. But I'm definitely interested in seeing what others are doing so that we don't reinvent the wheel first.
Hello, everyone. My name is Crystal Phillips, and I work for Charm City Care Connections. And we provide services for homeless folks overseas and actively, people who are currently using drugs. And we have a very small food pantry, but our issue is, we try to make sure that the folks that we see that reoccurring, the families, we sit down and do a budget with them just to try to get to the bottom of what the situation is. And most of our clients, like I said, are actively users. So when they go to the DSS office, 9 times out of 10, they get put out because they can't complete the application. Or for our homeless folks, they don't have an address. So it always seemed to go back to a DSS or food stamp issue. So I'm trying my best to see if I could build a relationship with the Department of Social Services on North Avenue and Broadway, but I just wanted to share what our issue is now, that it always come back to DSS.
Thank you for sharing that. For is there any other input maybe on further elaborate on Rosemary's question? Any other policy issues or things of that nature to support? All right.
I go ahead. Okay.
No, go right ahead. I'm sorry.
Yeah. Okay. I think I was involved for the last 7 years in different places. And I think sometimes the biggest challenge with the advocacy piece of our work, it's always restricted because of federal regulation. Like yes, there is a food pack, for example, in Baltimore City, and you put this initiative, but at the end, there's no funding because there are a lot of federal requirements for you to get that money or to get that service. So I spoke about it before, and it's nothing happening because you need something bigger other than just the grassroots organization on the field to help, but you need something beyond that, because for me personally, there are certain federal legislation that has to change, or no one has to come for us to play a bigger role.
Understood. All right. And I believe, did anybody else want to say anything before we move on? Wasn't sure if I cut anybody else off. All right, so we have about 5 minutes left. So I want to ask maybe a little bit more of a personal question for our panelists. I wanted to know what motivates you personally, and just maybe a short answer if possible. What motivates you to do this type of work?
I'll just go first for the interest of time. I'm from Baltimore City, and I've been hungry before, and I still have hungry family members.
Yeah. I think it's also not my upbringing also. Originally, I'm not from here, from Morocco. So coming, being in Florida and, working with this and directly with group, this population, especially through farming and moving north, I think that the thing that when you wake up in the morning, you just always try to figure out a way how to make things happen with the restricted tools and means you have in your hand.
For me, on a very personal note, I'm almost 7 years sober, and something that I learned during that time is that you really are only as strong as the community standing behind you. And I attribute a lot of, what feels good about my life to that community. And that's something that I really love about Moveable Feast, is that it's not just the meals that we are delivering and addressing food insecurity, but also this idea that no one should be alone, and the way that not just our organization, but these organizations show up for individuals and show up for families. I mean, it's so much deeper than filling a belly. It's filling hearts and souls. And we're building this together, and that's why I'm here doing this work.
All right, well, thank you all so much for sharing a little bit of insight about yourselves. I think it's really important to kind of like know the reasons why, or know your why reason. before we're getting hearts in the chat, everyone. Before we conclude, I want to open, I have a little bit of information to share with people. I want to see if there are any other questions that anybody wants to ask before we move on. Going once, going twice. Alrighty. So thank you all once again so much for attending and being part of this event. Once again, this was to kick off, or let's give a shout out and a round of applause to our participants, our panelists. Thank you all so much for coming and sharing this time with us and for the work that you all do. In case you can't see, you're getting applause and hearts and thank yous. But moving right along, and for the sake of time, because I know that everyone's time is very precious, once again, remember, this was to kick off our Baltimore week. Baltimore week is from today until Friday. We have our Source canned food drive going on right now. The donation bins are in any of the, the Bloomberg School of Public Health, the School of Medicine, and inside of the School of Medicine, you'll see signage. Hopefully my colleagues are dropping notes and things of that nature in the chat. We have our panel on community engagement, dispelling myths and providing tips tomorrow. That's tomorrow, October 4th at 12:15 to 1:15 p.m. You can check the chats, and signups for that will be in the chat. If you're interested in coming to this, please register. We'd love to get you all out there. It's going to be in the Anna Beta room inside of the Bloomberg School of Public Health. We also then have our East Baltimore bus tour, which is on Thursday, October 6th from 12 to 2 p.m., where you'll get the chance to kind of see some of our community partners where they are. And just a spoiler alert, some of these organizations that came and spoke to you are on the tour, so you'll see where their actual physical offices are located. Once again, those are in the chat, so please register for that. And then we are going to be finishing up on Friday in collaboration. We're finishing up on Friday in collaboration with the Anna Bader Society. We'll be hosting a film screening of A Past Due, which is a discussion about our housing crisis right here in Baltimore. So once again, signups for all those events are in the chat. Thank you so much, panelists, for coming, and thank you all for the work that you all do in the community. I know with everything that you all do, it can still seem like there's so much more to do, or like your hands are tied behind your back with the policies and everything like that. But the work that you all do is great, and hopefully we can get some interest from the students to contribute and help as much as we can. So thank you all once again, and happy Baltimore week, everybody.
Happy Baltimore week. Thank you so much.
No problem.
Thanks, everyone.
Thank you.